Very good. You do understand that. And do you understand it too, ma'am? Yes. The last thing I want to teach you about is pain control. There is going to be discomfort along that incisional wall because they've gone through some muscle layers to remove your gallbladder. You will have medication ordered to keep you comfortable. You need to understand the pain scale of 0 to 10, 0 no pain, 10 the most, and what level do you want to keep your pain below? You want it below a 4. Okay. So do you understand the pain management? Very good. Okay, so I need to check that off. The other thing I need to ask you, have you ever had surgery before? You have, once a long time ago. Have you ever had a reaction to the anesthesia agents that they gave you? No. Okay. Are you on any kind of agent that could cause you to bruise easily, like aspirin, heparin, Coumadin, Aleve, ibuprofen, Motrin, or been on any steroids? No. Okay. Any history of any type of hepatitis, exposure to the HIV virus, or any recent exposure to contagious disease like TB or strep throat, pneumonia? No. So you've been fairly healthy. That's great. Okay. Well, it looks like they're here to get you, sir, and take you downstairs. And, ma'am, you can go with him. And I'm just going to put down the time here that you left and that I sent you to OR. And you know, I did forget something, sir. Are you allergic to any medications? Oh, yes, I asked you that, didn't I? But I forgot to ask you if you had any allergic reaction to latex or a type of glove material. No? Okay. Very good. All right. Well, I'll see you back here after you have your recovery period in the PACU. Okay. So you just make a short narrative note here on the nurse's notes that Mr. Toome is alert and oriented ×4. His color is pale pink. His skin is warm and dry. His respirations are even and unlabored. He denies any discomfort at this time and voices understanding of the noted teaching above and is ready to go to surgery. And then you signature this and you date it. So you are done with the pre-op part of this. And your concept was that you documented understanding of the surgical procedure, you explained the legal form to the patient, and they signed it, that you stated the reason for and demonstrated to the client how to move, perform leg exercises, and coughing and deep breathing exercises, and that you clarified the client's concerns related to postoperative pain and its control. Now, we're going to pretend that he has come back, and I've been alerted by the aide that the transport person has brought my guy back up from PACU. The report has been called that he had a uneventful surgery, no complications, and that he is drowsy and awake, but his pain is under control. Okay. Hello, sir. How are you doing? It's your nurse again. It's the student nurse, Marlena. I just want to check and see how you're doing. Are you having any pain right now? You are. And what is the pain? It's at a 4. So do you need me to call the nurse to get you something for pain right now because you don't want it to go too long? No, you don't want anything right now? Okay. Well, I just want to check your blood pressure here. And it's 120/87. And I want to listen to your heartbeat. Now, I'm going to be checking his respirations too, but of course I'm not going to tell him that. Okay, his respirators are 14 a minute, and his heart rate is 78 a minute. His oxygen saturation is 98. His color is pale pink, and his airway's patent. So, and his IV fluids are, the post-op order is still for normal saline, except now it's at 100 cc's an hour. And I did identify him, sorry about that, but that he is the correct patient and his birth date, and he stated his name for me. And his temperature, again, we're going to check that, is okay. So are you cold, sir? No, you're okay? All right. The next thing you want to do when you get your patient back from surgery is to check the incisional area. Sir, I'm just going to look here at your dressing, okay? Okay. It's dry and intact. There is no drainage. If there was, I would mark this with a Sharpie and put the time so we would know. Looks fine. Okay, sir. All right. Well, I'm going to let you rest. I'll come back in a little bit and check on you. All right. Okay. We're going to say 2 days has passed and he's going home. I have my orders to discharge him home. And the first thing it says to DC IV. So I'll gather my equipment, my gloves, and these 2x2 should be in a package. My tape, and go in the room. Hello. Can you state your name for me, sir? And your date of birth? Okay. Well, you know we've met before. It's Marlena, and I just have an order to get your IV out because I understand that you're going home today and that you have recovered well from your surgery. That's good. Okay. First thing I'm going to do is clamp off the IV. So it's clamped off. Take an alcohol swab and clean the tape really well. We go get an alcohol swab. Okay, clean that really well, loosen it up. Go ahead and tear 2 pieces of tape. Have your package open with your 2x2s. Sir, you have any discomfort with this IV right now? No? That's good. Okay. Well, I'm just going to take it out and hold pressure for a couple of minutes. Then I'll put the dressing on. Okay? So first, I'm going to gently pull up while holding down on the skin so I don't pull his skin up. Okay. Alright, sir, I'm just going to pull it out. Now you want to hold it up and look at eye level that the tip is intact, that it did not break off and could cause a problem. So the tip is intact. Okay. I'm going to hold for 2 minutes. There's no blood. Can you wiggle your fingers for me? Okay, not bleeding. Now I'm going to put a new dressing on there. Let that set. Put my tape on there. Okay, I've still got the dirty one wadded up in my hand. Okay, now I can pull this over top of the tip like that. And I'll dispose of that in an appropriate container because it does have a blood product on the end of it. Alright. Okay, sir. Well, I'll go tell your nurse that your IV is out and you're ready to get out of here. Thank you very much. Okay, the end of this, what you'll do is take a nurse's notes that has the DAR, and you're going to write that he has an IV site in his right ventral site, and that you discontinued the IV per order of the physician. The catheter tip was intact. There was no redness, no edema, no drainage at the site, and you instructed the patient to notify the physician if after he goes home that he develops a problem at the site, and that you covered the area with a 2x2 gauze and silk tape, and then sign your name. And that's the end of the skill. If you have any questions, you can contact your instructor, Mrs. Buchanan.